here at our second Heals for Hearts. We are excited to be here tonight. We haven't been here since 2020. And so the event is a cardiac wellness event, and it's for women to learn more about cardio wellness, signs and symptoms of a heart attack, how to stay healthy, how to exercise that keeps your heart healthy, and a good diet to maintain heart health. We have a great group of panelists that are going to be with us tonight. We have Dr. Sean Prejean, who's an interventional cardiologist. We also have Michelle Bricino. She's a registered dietitian. She specializes in obesity medicine. We have Amelia Castell. She is a community wellness coordinator. She'll be talking more about exercise and health and how you can stay heart healthy. And then we also have Amanda Laperouse. She's a behavioral specialist who can talk a little bit about the psychology behind having a good heart health and staying healthy.
Good evening, everyone. I am Mary Chauvin, and I'm honored to be your MC tonight for our second annual Heals for Hearts Cardiac Wellness Social. This event was actually made possible and free by our sponsors, Cardiovascular Institute of the South, Terrebonne General Health System, and the Foundation for Terrebonne General. I'd also, before we get started, I want to shout out to the committee here who put this together. So all the volunteers in the committee, would y'all please wave your hands so everybody can see who you are? Yay! We gather tonight knowing that cardiac health is something all women need to be aware of. After all, knowledge is the first step in prevention. Even more fitting, today is International Women's Day. What a better time to take a moment to focus on ourselves and our health. Statistics show that cardiovascular disease, including coronary heart disease, is the most common cause of disability and death in women in the United States, even more than all forms of cancer combined. I just want to, on this note, I just want to say that when I got called to ask to be the MC for this event tonight, the day before I got the email asking me, I was in the emergency room with my 35-year-old daughter who was having chest pains. Wave, Mel. So it affects everybody, right? So at this time, I'd like to turn the microphone over to Diane Yates. Diane is the Chief Operating Officer at Terrebonne General Health System.
Good evening, everybody, and welcome. And thanks for joining us this evening. I'm glad you're taking the time out of your busy day to attend the Heals for Heart, a cardiac wellness event, to learn more about heart health and how we can actually take charge of it for ourselves. I do want to mention that our CEO, Ms. Phyllis Peoples, sends her welcome and her regards. Unfortunately, she could not attend tonight, but she certainly sends her best wishes. As women, we always care for other members of our family and friends, but tonight this is about self-care. And it happens to be International Women's Day, as Mary mentioned. So I hope you feel empowered by this information and you take some valuable points away for this evening. We have a fantastic group of experts here tonight, and they will be introduced to you in just a little bit. And you know, can't wait to share their expertise with you. To help you have a healthier heart and a healthier life. As the healthcare leaders in our community, it is a privilege to provide educational programs that offer life-saving information. I encourage you to take as much information away tonight as possible, ask questions, and most of all, enjoy yourselves. We've prepped our panel for all your questions tonight, so please do not be shy. And I challenge you to get one takeaway from our experts and then use it in your daily life. So without further ado, I'll turn this back over to our Mistress of Ceremonies, Miss Mary Chauvin. Whoever she is.
So tonight's esteemed panel of experts will help us to recognize the factors that put women at high risk for heart disease and ways to maintain a healthy, happy lifestyle. Allow me to introduce our panel. Dr. Shane Prejean. interventional cardiologist at Cardiovascular Institute of the South in Houma. Dr. Prejean graduated cum laude with a Bachelor of Science degree from Nicholls State University. He completed his medical degree at LSU Health Science Center in New Orleans. His residency in internal medicine was completed at LSU Internal Medicine Residency in Baton Rouge, and there he was named Chief Resident. Does anybody know what that means? Do y'all know what that means? I just found out. I just found out that he was picked over all of the residents that were at the school, and he had to eat. Became like a teacher to those residents, and he served a whole nother year, added a whole nother year. That's big. Yay! Thank you, Dr. Shane. We're so proud of you. So Dr. Prejean is board certified in internal medicine, cardiovascular disease, echocardiography, interventional cardiology, and cardiovascular computed tomography. That's awesome. He is part of the CIS structural heart programs in Houma and Baton Rouge and working closely with the cardiovascular surgeons as part of the comprehensive heart team. Welcome, Dr. Prejean. Yay. Next, we have Amanda Laperouse. Amanda, wait. Amanda is the director of the Cardiovascular Behavioral Health at Cardiovascular Institute of the South. Amanda holds a master's degree in psychological counseling. She is a board-licensed professional counselor in the state of Louisiana. She is certified in functional family therapy and has worked with youth, adult, and elderly populations in a variety of settings. Her role at CIS, Amanda is committed to the development of programs which offer value-based care, enhancing patient access to supportive experts, and reducing the impact of social determinants of health. She has been with CIS for 8 years. Yay, Amanda. Next is Michelle Brasino. Michelle is a registered dietitian at Terrebonne General Health System. Michelle holds 2 bachelor's degrees from Nicholls State University, one in biology pre-med and the other in dietetics. She also holds a master's degree from the University of Southern Mississippi in nutrition and food systems. Most recently, Michelle became one of only 3 Louisiana board-certified obesity and weight management specialists. To say that nutrition education and weight management is Michelle's superpower is no understatement. Michelle currently serves as an outpatient registered dietitian at Terrebonne General Health System. Yay for Michelle. And next we have Amelia Castile. She's the Community Wellness Project Coordinator at Terrebonne General. Amelia holds a bachelor's degree in Allied Health Science with a concentration in athletic training and a master's degree in Higher Education Administration, both from Nicholls State University. She is a certified and licensed athletic trainer, certified strength and conditioning specialist, certified personal trainer, and a certified facilitator for tactile strength and conditioning. Don't mess with Amelia. Amelia has extensive experience working with student athletes in the secondary school and collegiate setting. As the Community Wellness Project Coordinator, Amelia is branching out into corporate wellness and tactile performance training for our first responders with a focus on injury prevention. Pretty cool, huh? So we have a great panel. Let's hear it for our panel. So now each presenter is going to do a little talk, I think with a PowerPoint presentation. And so the first one is going to be Dr. Shane Prejean. Are you going to come up here? Okay. All right. And I apologize. Are you going to use this? Yeah, I use this. That's all right.
First of all, thank y'all for having me. A little bit intimidating being the only guy in the room. But I'm really excited to see the passion and the involvement from the community to come out for this event. It speaks to the fact that we're engaging women more in their own health care, and I just applaud you for coming out. I work for CIS. I'm one of the cardiologists here, and we've had a long relationship with Terrebonne General Hospital and trying to better the heart health of the community at Terrebonne Parish and the surrounding communities. So we've done a great job over the years. I'm really pumped to see this many women in one room to hear about heart health and just to learn more on prevention and what we should be doing to keep our hearts healthy. So first of all, we're going to start with a couple definitions. So you hear about coronary artery disease, and it's like, what is that? You know, the heart's kind of a complex structure. So we'll talk about what these things are, and then we'll talk about different ways to prevent some of the stats amongst women as we go through. So coronary artery disease is atherosclerosis or plaque, the buildup of cholesterol plaque in the heart arteries. So that's one form of coronary artery disease. The other forms of the disease can affect the smaller blood vessels in the heart. So this is the heart, and the heart's the pump for the blood in your body. And on the outside of the heart are these bigger blood vessels called the coronary arteries. But you can see on the right of the screen, that actually gets down to very microscopic blood vessels in the heart. So any disease that affects that arterial system in the heart can be considered coronary artery disease. This is a depiction of what a normal artery looks like on the top, and then on the bottom is an artery that's diseased with atherosclerosis, or the plaque that can affect any of the arteries in the body. So what is a heart attack? So a heart attack is when you take a blood vessel in the heart that has normal blood flow, and then all of a sudden the blood flow is interrupted. So in that instance, you have interruption of the oxygen and nutrient-rich blood to the heart muscle. So the heart muscle is a pump. The heart is a pump. It's made out of muscle, and it needs to get continuous oxygen and nutrients from these blood vessels. So if that all of a sudden closes off, that's a heart attack. Okay, so you got a piece of the heart that is struggling because it doesn't have enough oxygen and blood flow. So this is a depiction from the top of what a normal blood vessel would look like. You can see that it's not just overnight that you develop a situation where you might have a heart attack. So you start off with some cholesterol deposits in the arterial wall, and that ends up forming a vulnerable plaque. And that plaque can either become stabilized. Specifically, we like to catch that plaque early and treat it, by adjusting your different risk factors for it to get worse, or it can continue to grow, and eventually if it breaks open, the body's response is to close off that blood vessel with a blood clot. Okay, it's just a natural response to any injury in the body, but unfortunately for the heart, if you close off the blood flow with a blood clot, then you can't get the oxygen and nutrients to the heart tissue that would be supplied by that artery. So that's what would happen in the setting of a heart attack. So in that situation, we're going to talk about some symptoms of heart disease a little bit later on my talk, but you may get symptoms as that artery is starting to narrow, and it'd be important to kind of pay attention to those symptoms so that we can hopefully catch it, treat it, manage it. And that's just simple clinic visits. I tell everybody in my clinic, I'd rather see you on the front end than on the back end. So if we can get on top of all these things in clinic and do the preventative approach, then we never have to worry about the heart attack or the stroke and things like that. So as opposed to if I meet someone in the hospital and their first presentation is a heart attack or a stroke, well, we're kind of behind the 8 ball. So we're trying to halt this process in its tracks ahead of time. So what's the prevalence of heart disease in America, and it's specifically in women? So it outnumbers that of all cancers combined, as you heard in the intro. So, I feel that the movements have been excellent in terms of getting the information to women about breast cancer, about different women's health issues. But if you go by the numbers, heart disease actually affects and kills more women in America than those other diseases. So we've got to do a better job of getting the information to women so that they can protect their hearts, in addition to all the other issues that are on the slide. So 1 in 3 deaths in women is related to coronary heart disease, and 1 in 31 deaths in breast cancer. So that's just a stark comparison. I think, number one, it's the prevalence, so it's a lot more common of a disease, and number two, it's how we're treating it. So we've gotten the awareness out, everybody's going to get their mammograms, they're doing everything they can to prevent breast cancer. Are we doing the same thing to prevent the heart disease? I think we have a long way to go in that regard. So recognition. Despite increases in awareness, we wear red. We go red for women. We do a lot of efforts. We do events like this to try and get awareness. Despite those initiatives to increase awareness, only about 54% of women who are polled recognize that heart disease is the #1 cause of death in women. About 90% of women have one or more risk factors for heart disease. At their first heart attack, 26% of women aged 45 and older die within a year, as compared to 19% of men. 2 out of 3 women who die of heart disease have no previous warning signs. So I think getting to some sort of healthcare provider early to say, what are my risks for this? Do I need to see a cardiologist? Those type things, getting there early would prevent the first presentation of this disease, which is a deadly disease, as being a heart attack and potentially even death. So what are the traditional risk factors for heart disease? So smoking, diabetes, high cholesterol, high blood pressure, obesity, physical inactivity, family history, depression, and stress. Okay, so this is everybody, men, women, doesn't matter. These are the traditional risk factors that we all need to worry about. And then there are specific risk factors that apply to women. Okay, so women, for example, because of our anatomies, have smaller blood vessels than men. So when we're treating the disease, we have to take into special considerations for that. Women undergo this little thing, which I know a lot of you are aware of, is pregnancy. Okay, so that's something that men, we don't always recognize it and appreciate it, but we don't have to deal with that, So that puts stress on the body. And there are certain cardiovascular diseases that are associated with pregnancy. For example, preeclampsia. You've heard of women getting higher blood pressure in their pregnancy, and that can present as a disease called preeclampsia. Well, those patients not only have it during pregnancy, they're at a higher risk to develop hypertension and other forms of heart disease after pregnancy. So that's your initial warning sign, and a lot of times they're saying, well, we delivered the baby, blood pressure's back to normal, you're doing good. Well, if I see those patients in the hospital, I say, no, I'd like you to follow so that we can make sure we're doing everything else we can to help protect your heart. Peripartum cardiomyopathy, gestational diabetes, higher incidence of autoimmune diseases, which may lead to heart disease, treatment of breast cancer, which we had mentioned breast cancer earlier. The treatment itself can affect the heart. Polycystic ovarian disease, menopausal status. So we know after menopause that women are initially protected by the estrogen, but as your estrogen levels decline, you catch up to men in terms of the risk of heart disease going forward. Vasospasm are just functional disorders of the blood vessels, and then Takotsubo disease, which is kind of the broken heart syndrome, in which stress can actually cause weakening of the heart, and that's more common in women. So this is how atherosclerosis would present in the body, okay? So narrowing of certain arteries can cause higher blood pressure. So a stroke is almost the equivalent of a heart attack. That's kind of like a brain attack. It's a sudden interruption of good blood flow to the brain. Heart attack, which may lead to heart failure. Peripheral arterial disease in the legs. So that typically presents as leg pain with walking. It can present as ulcers on the feet and may ultimately lead to amputations. Aneurysms of the aorta and other blood vessels, and then ischemia to the bowel. So women's signs and symptoms of atherosclerosis and other diseases affecting the arteries may be different. So the traditional depiction, if you Google a heart attack, is like a man holding his chest, the worst chest pain you ever felt, the big pressure on the chest. We know there are other symptoms of lack of blood flow to the heart, and especially in women, you may have those symptoms. So these include nausea and vomiting, feeling lightheadedness or weakness, shortness of breath, chest discomfort, which you may present in the typical way, but it's also important to know these other symptoms. Pain in the jaw, the back, or your stomach area, fainting, breaking out in a cold sweat, especially if you're exerting yourself, which would be something out of the routine for you that you normally don't have that. Unusual fatigue, difficulty sleeping, paleness or clammy skin. So these are just other symptoms to think about. If it's not normal for you, then we don't want to blow it off, you know. And if the first person you go to doesn't listen, then maybe, you know, seek another opinion or something like that. Again, women's hearts are very different. The symptoms are, it's been documented in clinical studies that the symptoms are often unrecognized. Women are less likely to be referred for testing. They have less recognized risk factors. We saw a whole nother list on the right side of that slide earlier that is specific to females. Stress testing can be less specific. Traditional risk factors may be less specific because a lot of the clinical trials are predominantly men that were studied. And then we know the outcomes are still worse in women. Just like we know the outcomes are worse, for example, in our minority population, okay? There has to be some intrinsic biases in our system which treat women differently, just like we see in the minority population. So events like this increase awareness. We have initiatives in terms of the healthcare workforce to increase awareness so that we don't miss an opportunity to help women with heart disease. This is a perfect illustration of that. So this is cardiovascular deaths in America. And around the, the early 80s, really there was many booms and advancements in the treatments of cardiovascular disease. We didn't start using aspirin for heart attacks until the 80s. And that's how far we've come with all the technology we have nowadays. So you saw just an immediate decline in the deaths from heart disease amongst men. How long did it take to start trending down for women? You see several decades went by before we see the downtrend. So we have to do a better job. And that's something we acknowledge in the healthcare community. And that's why these events are important. Why is this the case? From my own personal experience, you are propping up your entire ecosystem, okay? So you might have kids, you might have a spouse, you might have parents, you're taking care of them, right? So I think that women often get a delay in care because they're taking care of everybody else, okay? And I really applaud you for that. And I think it's very important to recognize that we have to take time for our own health. And it's just an incredible thing where women stand in society in terms of propping everybody else up. But we've got to prop you up, too, in terms of making you heart healthy. All right, so in summary, heart disease is the #1 killer of women in the United States. There continues to be disparities in the recognition, treatment, and outcome for women with cardiovascular disease. You need to take steps to know your risk and how to reduce your risk. There's some great talks following me for not only medications and things like that, which I do as a physician, but other lifestyle changes that we can make to help prevent heart disease. Know the atypical signs in addition to the typical signs of heart disease, and be your own advocate. So I appreciate y'all coming out tonight. It's great to be here to speak with you. And I look forward to the rest of the talks on our panel as we learn more.
Okay. All right, so does anybody have a question right now for Dr. Prejean? Okay.
You had mentioned about sleep being like you need a consistent 4 hours a night, 5 hours a night, waking up every couple hours a night. Is that an indicator of a possible problem? Or?
Yeah, so we know that anything that puts additional stress on the body over time can lead to worsening heart disease. So, for example, if you have people that have a like type A personality, for example, that has been studied in the psychiatry literature, that if you're always kind of revved up and things like that, things that activate your sympathetic nervous system increase your likelihood of developing things like high blood pressure and heart disease. So sleep health is another important factor to decrease the stress on your body, okay? So normally, most studies say you need about 6 or 7 hours of sleep. 8, in some is the best. So if you're getting 4 hours of sleep, especially if it's interrupted, that may be disrupting your sleep-wake cycle, which can affect your blood pressure and heart rate and things, and also put additional stress on the body. Okay. it may or not be a symptom of heart disease, but it may put you at a little bit higher risk. So I think sleep health is important. There are also heart conditions that make it hard to sleep. For example, in congestive heart failure, if you can't lay flat, people have trouble sleeping in that particular disorder because they're waking up either coughing, short of breath, and different things like that. So it may be both sides of the coin, actually.
How often should somebody go get checked?
Good question. So I think it's amazing what's happening in America right now. One of our specialists is a child obesity expert, okay? So having regular care from some sort of primary care provider, I think, is the first step, okay? I get referrals all the time for kids now who are overweight, who have high blood pressure, high cholesterol, diabetes, and things like that. So I don't think it's ever too early. And I think that majority of the time, I think the main workforce for preventative care is still your primary care doctor. And it's important to get with them and make sure that you're controlling all the risk factors we mentioned for heart disease. That's number one. Things that may point to the fact that you need to see a more specialized person, maybe if you have a strong family history, if you've got some of these other risk factors that are starting to stack up. One of the things I didn't mention in the slide, but it's an incremental, like an exponential increase in your risk of heart disease the more of these risk factors you add up. So it's not like one is 2%, the next one's going to be 4%. The next one might be 8 or 9% increase in risk as opposed to someone without those conditions. So I think knowing yourself and your own heart conditions, knowing your family history, or if you want to be safe, you know, we always see people, no matter what their symptoms are or their background at CIS, and just say, hey, if you don't have anything going wrong with you right now, I'm just going to check in and make sure we're hitting all those points that we're preventing the disease.
The next presenter is going to be Amanda Laperouse.
Thank you. All right, everybody. So I hope that majority of you finished chewing. Looks like it. So I'm Amanda Laperouse, and I'm going to talk to you today a little bit about a cultural approach to health equity. But to get you started, we have got to celebrate International Women's Day. So I'm going to need you to muster up whatever calories you want to burn, and I'm going to need to get you to stand for me for a minute. So the first thing that I want you to do is I want you to just take a brief look to your left and a look to your right, and I want you to recognize the individual, unique, beautiful human beings that are standing by you. And the next thing I want you to do is I want you to say something empowering to these people, whether it be a friend that you've known for a long time or somebody new you met today. Say something inspiring and empowering to them. Great job, Dr. Prejean. You are relating to women. So, thank you.
Amazing.
I love this. How original, too. So I want you to, for a minute, just spend an awe in this moment. What does it feel like to empower the beautiful, unique human beings that you're looking at? And how often do you spend time empowering women? How often are you working to help make sure that we are in an equitable world? Because a lot of times, women, each our own selves, don't spend enough energy pouring into the cups of each other. So the next thing I want you to do is, like these beautiful individuals on the slide, I want you to embrace yourself. And I'm going to try to do this while holding my mic. So while you're giving yourself a nice embrace, I want you to say something empowering about you. Are you fierce? Are you smart? Are you intelligent? Are you beautiful? Are you a mother, a wife? I think when you really stop to think about it, empowerment and starting with embracing equity starts with you. And how often are you spending energy doing something like that? Go ahead and have a seat. You know, imagine a world where gender would be equal, where a world that we wouldn't have bias or stereotypes, that would be diverse, and we would celebrate diverseness fiercely. And collectively, I believe we can embrace equality, but it starts with you. And I think that you have to take whatever you felt from this exercise that we just did and pay that forward so that we can continue to be the change we want to see in the world. So is health equality the same thing as health equity? I asked the question to the audience. No, right? That's false. Because when you truly think about it, health equity is about making sure that we are affording various differences to those different groups and audiences that might need it. And I'm here to tell you that a lot of times people thought, well, if I didn't come from a different socioeconomic status in the world, or I didn't come from a different group, that meant that I didn't have any kind of special need, that I was going to be treated equitably. But I will tell you that women in the United States experience more disparity throughout their lifespan. And as a result of it, I do genuinely believe this is one of the impacts that we are seeing on disease, specifically in women in the healthcare system. So I do want you to think about that, think what you're doing to create the variation of difference so that we aren't treating people equally, but we're treating them with equity. So why does culture even play a role in healthcare? You know, culture is oftentimes described as a body of knowledge or a body of belief or a body of behavior, but there are all these different elements of culture. So there are elements about your ethnicity and your race and your religion, your personal identification of self, your language and how you communicate, your thoughts and beliefs. How do you think that that's impacting how you interact with your healthcare providers, your decision to interact in going to see a healthcare provider, prioritizing yourself, and often how you're communicating or interacting when you're there about the next steps that you need to take in your own health? How often do women spend the time saying, I'll prioritize my others first? Like Dr. Prejean said, we'll prop everyone else up. If we're gonna pay for someone to see a specialist, it'll be our child, maybe our aging parent that we're helping to care for, and we won't take that time to go to the specialist for ourselves. One thing that as healthcare providers we're challenging ourselves to do is think about how we can deliver services more respectfully and responsive based on what your health beliefs are, based off the practices that you respect and the culture that you represent. Because I'm here to tell you that people are these beautiful blended cultural backgrounds, and you know, all of that is impacting how you approach your health. So what are 7 ways that culture really influences healthcare? I want you to stop for a minute and think about your own personal culture. What are your beliefs? Do you have certain beliefs about the family of origin you were raised in, and then the community of people that you belong with, the social groups that you spend energy with? How does that influence your decision to approach your own health? I'm talking about religion, not necessarily about those that are really truly zealous just about religion, but people who really think that it is a way of life and sometimes will abstain from doing certain things as a cultural practice or a religious practice that could impact their health in some way, whether that be a decision, a belief about medication and whether or not I should use certain medications. What are your perspectives on death? I'm not talking about whether or not you believe about life after death, but have you had a conversation with your healthcare provider about what your end-of-life plan would look like? Have you talked to your family about that and made sure that they would know how to respect whatever choices you would want to make? You see, your culture is impacting whether or not you have certain conversations or even make decisions. And now what we know about what Dr. Prejean was referring to, your body's ability to respond to medication is very much impacted by your ethnicity and your gender as well. So whether or not you can physically take a certain medication really does make a difference. So who are you? What's the identifying individual culture? Which of these really drives Bevy, or drives Trudy, or Diane? Because I can promise you that each of you, despite the fact that you are women, would have very unique, different responses. And so when you think about your age and your education and your decision to spend time pouring into yourself, you really need to immerse yourself in understanding what is driving the decisions that you make about your health and also the health that you are receiving from someone else. Would you see a male cardiologist? Would you entrust them with all of the things? Or would you be driven to try and have a primary care provider treat you for a specialty like heart disease? I don't know about you, but I was never planning for my general practitioner to deliver my children. I was always going to see a specialist. And I think the same should be about cardiology. So what impact do you think that culture has on health? Do you believe that it's about diagnosis? Do you think that culture has an impact on treatments that we can provide? What would be your answer? Anybody? Brave? It's actually both. So when you think about the impact that culture is going to have on health and the health care that you're going to receive, it's going to have an impact on the diagnoses you receive, the treatment options available, and how you're going to approach. Social determinants of health is one thing that Mary mentioned in my initial introduction of self, my bio. And it's something I've spent a lot of myself during my time at CIS studying, because I do believe that social determinants of health, despite your socioeconomic status, really do have a lasting impact on your risks for poorer health. And some of the things listed here might not be what you originally thought of when I said social determinants of health. How many of you engage in unhealthy eating? Folks, we just went through Mardi Gras. How many of you had king cake? Just a few. What about emotional eating or emotionally driven eating? I'm very grateful to not have Michelle's seat on the panel. But a sedentary lifestyle. You know, we were having a conversation right before we began talking about the fact that the hospital really does try to promote teaching you to come to these well and wise events where you can empower yourself with knowledge. But what are you going home and doing after? Are you coming here and enjoying a meal and gaining knowledge and then never taking something home and putting it into action? I think Amelia will talk to you a little bit about your lack of exercise and trying to become less sedentary. Consuming alcohol, many of us do this. And how are you doing this in moderation, and how is that impacting you? Tobacco use and smoking are the #1 preventable risk factors of heart disease. So I would hope that if you know anyone who's making a decision to engage in this behavior, that you would talk to them about this as a risk. Obviously, high stress is something we spend a lot of energy focusing on, but I think as women, we already knew we were experiencing high amounts of stress. This is something that inevitably everyone faces. We cannot remove stress from your life. I would pivot to want to know, how do you cope with your stress? Because sometimes these very same beautiful people that I'm looking at likely cope with stress by one of these unhealthy behaviors, such as drinking alcohol or emotional or unhealthy eating, or maybe vegging out on a couch and watching a little bit of Netflix and being a little sedentary. And then sleep habits, we obviously have talked a little bit about this, and that's a, I think, more depth conversation with regard to sleep hygiene. But there are a lot of things that impact whether or not sleep hygiene is going to cause a negative impact. But look at the scale. The more health behaviors or unhealthy behaviors you engage in, the more likely you are to have poor health outcomes. Ladies, this has been researched. This has been proven. This is not something that we need to wake up today and say, maybe what Amanda's talking about is true. This is true. And I think we have a lot of power in what we decide to do tomorrow to change our next day and the ones before it. So our opportunities for action, I think, are really depicted here, and I believe we have an esteemed panel that are really going to be experts of nutrition as well as exercise that are going to talk to you about that. I thank you so much for your time today. You are a great audience.
Let's see if they have questions for you. All right, so up next is Michelle Brasino.
Good evening. I apologize in advance. Everybody that listens to me talk, they always say, man, I didn't want to hear that. And we all know, you know, but when I say it, it just confirms it. So I apologize in advance, okay? All right, so I'm going to start off with some common diet myths that affect heart health. So one of the first things I hear is, well, the doctor told me I had to eat less salt, but I eat sea salt. Guess what? It's still salt, okay? So the whole misconception with sea salt versus table salt is that sea salt tends to have trace minerals. Your table salt is going to be things that are mined and those minerals are lost, and then things like iodine is going to be added to it after. But if you're looking to get minerals from your salt, when you could be getting them from other things, you're also going to have to increase that amount of salt in order to meet that mineral you're looking for, which is then going to increase that sodium. So salt is salt. If you prefer sea salt versus table salt, then good for you, but we still want to make sure that we're watching the amounts that we're eating in general, okay? All sugar is bad. I hear this often. All sugar is bad. Sugar is actually one of the things that can affect your heart, as well as diabetes. That's the one that people often assume sugar affects. There are different forms of sugar. So if you've ever looked at the new nutrition label, there's now an added sugar category, and that's because of this right here. So we have dairy sugar and fruit sugar, which are considered natural sources, and then we have added sugars, which is like table sugar and honey and jam and jelly and syrups and things like that. So sugar, when it comes to added sugars, are the ones that we want to watch, but the ones that come from our food sources like fruit and dairy are the good sugars. We still want to watch all those things, everything in moderation, but that's a very common misconception. Eat more fat. This came around the time of the keto movement, okay? And so we're going to kind of talk about that diet a little bit later, but this is one of the things that I hear often. I also have people that will say, well, my doctor told me I need to eat more nuts or more oils or seeds and things like that, which is true. But we don't want you to add them to your diet. We want to replace them from your diet. So if you're doing things like butter to cook, we want to replace it with an oil. We just want to have that flip-flop. We don't want to start adding all these things to our diet on top of everything else. All right, so there are different types of fats, and it becomes very confusing. You hear mono and poly and saturated and trans fats and hydrogenated, and you have all these crazy terms, okay? So this is a beautiful handout that the American Heart Association has created, and I think it shows everything perfectly. So the Love It category, that's going to be your mono and your poly unsaturated fats, and those are going to be things found in plant-based items, okay, with the exception of fish. So your oils, your avocado, your nuts, your seeds, those are going to be heart-healthy types of fats. Okay, those are the things we want to replace in our diet, the healthy things. We have the limit category, which is going to be saturated fats. Anything saturated typically comes from an animal source. This is going to be anything that is hard at room temperature. So when you're straining your fat from your meat and it solidifies, those are going to be considered your heart-harming fats. Your lose it category are going to be things that are artificially made in nature, so that's going to be your trans fats. Years ago, they have banned in the United States trans fats, but they haven't truly banned trans fats. They are still in our diet, but what the manufacturers have done is that you can't have more than 1 gram of trans fats in your food. So if you get 4 cookies and it gives you 1 gram of trans fat, then I'm going to change the serving size to 3 cookies, and now I don't have to legally tell you it's in there. So it's still in our food, okay? So just be aware. These are going to be in our foods. They're considered hydrogenated oils. You'll see the word hydrogenate in your foods. And then coconut oil, palm oil, and kernel oil. Those are the only 3 plant-based oils that are considered heart-harming, and they are higher in saturated fat than things like olive oil. So this is my plate. This is typically what we want your plate to look like. It's all 5 of your food groups, and those 5 food groups include things such as fats, proteins, and carbs. Your fats are going to be your heart healthy ones, what we talked about, your heart harming ones that we talked about, and that's going to be those sections there. Most of those food items are going to be things from protein and carbohydrates. And so we want to make sure that we're having a balanced plate as much as possible. Okay, now does our plate look like this in the South? Absolutely not. Okay. All right, so diet trends. Carnivore diet. So this one had kind of faded out for a little while, and then podcasts are really big, and TikTok is really big, and this started to surge again. So carnivore diet. It is a meat-only diet, and the thought process behind it is, well, our cavemen ate meat, and they, whatever. They're not here anymore, obviously, so a lot of good that does, okay? They avoid things like fruits and vegetables and grains and nuts and seeds and all those great things. So obviously not the best, because we know that animals are heart-harming fats. Keto diet. So 3 years ago, I was actually a speaker at this event, and that's when keto was starting to get really trendy. And someone asked, like, do I promote it? And I said, I don't like to promote anything that I don't have at least 5 to 10 years of research on. Well, irony, I'm here again. And guess what? Research is starting to come out. So the keto diet is a high-fat diet. It is 70% to 80% of the calories in your diet. Normal intake for fat is 25 to 30%. That's considered standard American Heart Association recommendations, okay? You avoid carbohydrates, and these are the different types of diets that fall into that range. So your paleo, your keto, your Atkins, your interval, your zone, your Whole30, those types of things, okay? Now we know that there are a bunch of different risks that are associated with a keto diet. The keto diet was originally designed for children with epilepsy, and the types of fats that they're eating were coming from something called MCT oil, or your plant-based oils. And the diet was originally designed to prevent seizures, so those children didn't have to take as many medications. The downside of that diet is that they lost weight very significantly, which is where people took it and ran. And they also had a lot of growth stunts, okay? So they're not on it for very long term. They're on it for short amounts of time. They get them off. They put them back on in order to prevent having to be on all these medications. Some of the risks of the way that people are doing keto diets now is that there's a lot of vitamin and mineral deficiencies, because if you're not eating things like fruits and vegetables, that's where most of your vitamins and minerals come from. A lot of kidney stones and gallstones, so we're having an increase of that. Gout has been very important, and if you've ever had someone that you know has gout, you do not want it. Increased risk of heart disease. So we're having a whole lot of people younger who are having a lot more high cholesterol and high blood pressure and things like that are coming from it. And when they come into the clinic and I say, well, what have you been doing? Oh, I've been doing keto for the last 2 years, and now my cholesterol is 400. I'm like, well, that might be why. So we are now getting research, and we're seeing these things that are happening to our body from some of these trendy diets. And like I said years ago, I don't like to know what's going to happen to you in the short term. Yes, you lost weight now, but at what risk to you 10 years from now? And 10 years from now, can you reverse what happened because of that little bit of weight loss that you lost, okay? So recommended, tried, true types of diets are going to be Mediterranean. It's a high fruit and vegetable diet, dash high fruit and vegetable diet. Y'all see a trend coming right here. Diabetes friendly, which is going to be considered half of your plate vegetables, once again. A quarter of it's going to be protein, and a quarter of it is going to be your grains. Volumetrics is something that I love to teach about. It is pretty much your plate method, but it's incorporating those vegetables into the foods you want. So down here, you know, you have spaghetti with corn and bread and dessert and a tiny little salad on the side. Okay, that's a common meal here. So it's about taking that meal and trying to make it as similar as possible, but by including different types of vegetables and stuff in the meal where that volume is there that you're looking for of all those foods, but it's in a healthier portion. So that's that half a plate I was talking about. So half of your plate should be non-starchy vegetables. A quarter is going to be protein, and a quarter is going to be carbohydrates, or your grains and your starchy vegetables. So we want to make sure that we're eating more of our healthy fats. So we're adding those foods or cooking with those types of fats. Eating more high fiber foods, so your whole wheat pasta, brown rice, wild rice, whole wheat bread, things like that. Your fruits and vegetables, keeping the skins when possible, so eat that potato skin. Beans and corn, those are going to be things that are going to help out with your blood pressure and your cholesterol and things like that. Any of your meat, we want to make sure that we're having your leaner cuts. Red meat recommendation, this is where people hate me, is 8 ounces a week. I know, I'm sorry. So it's going to be 2 servings. So it's considered a 3 to 4 ounce serving of meat is considered a serving size for a woman. So no more than 2 servings a week, and that is pork and beef, okay? And I have these little tubes in my office, and I love to show people. They are about yay big, and your 90% beef fills the entire vial of fat, whereas your chicken is only about this much, and then your fish is about this much. So it's a very great representation that even in your leanest cuts of your red meats, you still have way more than recommendation. Of course, limiting sugar, limiting sodium, saturated fats, trans fats, and then minimum 64 ounces of water. Women do not drink enough water. Okay, I can guarantee that. Everyone that walks through my office is like, oh, I drink water. I'm like, how much? Like 2 bottles. I'm like, no, that's not enough. So water is very important as well, especially in the heat of the summer. That is the label that I was telling you about. If you notice, it's a little hard to see, but at the bottom, it says total sugars, and then underneath it says added sugars. There was a lot of misconception about sugar, and people would look at it and say, oh, well, there's 20 grams of sugar, I'm staying away from it. But it may have been yogurt where it was fruit and yogurt, which are natural sources, and then they have the added that's in there. So now they're required by law to subtract out how much is considered added. Recommendation from the American Diabetes Association and the Heart Association says no more than 24 grams of added sugar for women, and 36 for men is not fair, but that's how it works, which is about 6 teaspoons of sugar total. Okay, a standard 20-ounce bottle of soda is 75 grams. So it adds up very fast. Okay, a half a cup of ice cream is your 24 ounces, or 24 grams. So have your ice cream and be done with it. The other thing that we can utilize with this label, and this is very important for heart health. So anytime I get anybody in the office, you know, you go to the doctor and they tell you, oh, we need to watch your cholesterol, or we need to watch your sodium, but like, they give you this handout of this is the stuff you stay away from, but they don't really tell you a whole lot, okay? So this is a rule we can use when you're looking at a label. That's a very easy rule. Instead of having to memorize, you only get 1,500 milligrams of sodium, or whatever rule they may give you, okay? So it's called the 5-20 rule. That's the only 2 numbers I want you to memorize. So everything right underneath total fat, it says saturated fat and trans fats, which are our heart harming, cholesterol and sodium, which we want less of in our diet. We're going to look at those daily values on the right-hand side. And each one of those percentages, we want to be 5% or less. That means low in fat, low in cholesterol, low in sodium. So if we're choosing more items that have a label that are 5% or less and low in, we're going to be choosing heart-healthy types of components. Okay. Now, on the reverse side of that, 20% or greater means high in. We want more dietary fiber in our diet. It helps with our heart health in general, helps with our weight. It sits in our stomach for a lot longer, so it prevents us from overeating. And they're coming from things like fruits and vegetables and whole grains. So we want to make sure that is going to be 20% or greater. So if maybe you're watching your sodium and you're watching your fat, and maybe you realize, oh, I'm not really eating a whole lot of fiber in my diet, that's a great place to start. Or maybe you just start looking at those labels better. You can also use that rule for your nutrients at the bottom. So if they tell you, hey, you need to increase your vitamin D or your calcium, a lot of times you'll see products that say enriched with or added to, and so you'll actually look like added orange juice, added vitamin D. If you look at it, it says 5%. 5% is low, right? So we want something that's at least 20% or greater. So if you're going to be purchasing products that have an added ingredient, you want to make sure that you're getting an actual decent source of any of those things. So this is a very easy way to kind of look at those things based on recommendations from your provider, and then kind of having that knowledge for yourself to know what you're actually eating. And of course, thank you.
Well, I guess thank you, Michelle. I mean, I'm going to have to change my diet. Okay, here's Amelia, everybody.
Hey, team. How we doing? I know, that was a bummer. I meet with Michelle. I'm a client of hers, so I've heard all this before, and it's tough, but it is a good challenge for yourself. And I kind of play games with myself, like, can I do it? How many meals can I prep? what's my calories for the day? So if you can make it fun or a game with yourself, that might be one method of attacking that. Okay, I'm here to talk about exercise. We're going to start with the data and the research and what it shows. Okay, so over the past 4 decades, there's been numerous studies, scientific reports that have examined the relationship between physical activity, fitness, and cardiovascular health. And a lot of the things I'm going to be talking about today are from American Heart Association, mainly, but the CDC, as well as the American College of Sports Medicine, okay? So those 3 entities created expert panels that reinforce scientific evidence that link regular physical activity to various measures of cardiovascular health. So the prevailing theme that those entities found was that the more active you are, the less coronary heart disease risk that you have, okay? Seems pretty common sense, but the data shows it. Just like she said, it's true. We don't have to wonder if it's true or not. It's true, okay? Like Dr. Prejean said, CHD here, coronary heart disease, that's where the arteries of the heart cannot deliver oxygen, rich blood to the heart, and that's the leading cause of death, like we've already, determined. So here, I think knowledge is power, and you guys showing up here to learn and better yourselves and empower yourselves with information is a great first step. And also, like Amanda said, we got to take what we're learning today and put it into action, okay? Even if it's just one little thing that you make a change in, that's one thing that you're doing better tomorrow than you were today. And then the reverse side of that coin, low levels of physical fitness equals higher rates of cardiovascular events and higher death rates. But it even shows that midlife increases in physical activity. So just like they say about smoking, if you stop smoking when you're 40, that has long-lasting effects, and you can kind of reverse some of that. Same thing with exercise. Even if wherever you are in your life right now, if you start instituting some more physical movement in your life, it can have beneficial rewards later on, okay? Despite this evidence, however, the vast majority of adults remain sedentary, okay? Less than 1/3 of Americans meet the minimal recommendations for activity as outlined by the CDC, the ACSM, and the American Heart Association. So that's less than 1/3, okay? We can do better than that. All right, benefits of regular exercise. A lot of these are common knowledge, but let's go over them real quick, okay? But a sedentary lifestyle is one of the 6 major risk factors for cardiovascular disease, okay? And if we can reduce any of these risk factors, we're going to better our chance of good outcomes. We're going to reduce our chance of having a heart attack or experiencing some other sort of cardiac event, such as a stroke. And it also reduces the possibility of needing a bypass surgery or an angioplasty. Okay? So here we're going to increase in our exercise tolerance. So the more that we exercise, and day 1, we're like, oh, this is horrible. This is so hard. I don't want to come back. Keep going back, okay? It's going to get easier. It doesn't get easier, but you adapt to that. You adapt to that activity that you're asking your body to do. And that's the physical reward of showing up to wherever you're going to show up and doing what you need to do, okay? Reduction in body weight, obviously. Most of us, that's a desired goal, okay? Reduction in blood pressure, reduction in LDL and total cholesterol, so that's our bad cholesterol. We're going to increase our good cholesterol. And in diabetic patients, regular activity favorably affects the body's ability to use insulin to control glucose levels in the blood. Okay, so all good things. More physiological benefits of exercise, okay? So we're going to have improved muscle function. A lot of what we work on with athletes and everything is muscle function as in regards to the neurological system. So if we can wake up that neurological system and get it talking to our muscular system in a good and healthy way, we're going to reap better benefits and have more functionality, more mobility, and we're getting a better benefit of our exercise if we incorporate that neurological system. But we're also going to have improved strength. I would encourage women to partake in strength training, okay? Even if it's just some little dumbbells. Guess what? You really got to work hard to bulk up, okay? I wouldn't worry so much about that. Some body types, I guess it does happen, and it can happen, and women will naturally, I guess, just based on their body composition, they will get that bulkiness, but that's rare. A lot of women got to really work hard to add muscle, just like men do, okay? So I wouldn't worry about that, but strength training has benefits. You do some strength training, you're burning calories the rest of the day. Whereas a lot of times with cardio, you're burning those calories during cardio, but it doesn't have as much of a lasting effect with the hours after that workout. Okay, so, and it's good for bone health, osteoporosis. You know, we're putting a load on those bones. I'm going to talk about it a little bit later, my favorite principle, but anything that you're going to do to your body, you're asking it to do, and it's going to reward you with getting better to adapt to those things you're asking it to do. Okay, so we're going to improve our aerobic capacity, improved vascular wall function, which is something we want, improved ability to provide oxygen to the muscles, bone health, like I said, and just your improved ability to perform daily activities. You know, if you're exercising, a lot of moms, okay, we're going to the beach, we're trying to carry all the things, right, down. We got the bags, we got the kids, we got the ice chest. Hopefully the man has the ice chest. But like, doing these strength training activities are going to help us in our activities of daily living, okay? Also, it's been shown to have a lower likelihood of back pain and disability for those people who regularly participate in exercise. And that's just some of the physiological benefits of exercise. That's not to mention like the confidence, the self-esteem, your mood is better, stress reduction, a more youthful appearance, better sleep, more energy, more brain power, okay? So, how much exercise is enough? In 1996, the Surgeon General's report on physical activity and health came out, and it was pretty much used as a springboard for the largest government effort to date to promote physical activity amongst Americans, okay? This report, so the Surgeon General's report, a joint consensus from the CDC and ACSM and the NIH all agree that at least 30 minutes of modest activity on most days is what we need, okay? Preferably all days, but out of the week, if you can get 5 out of 7 days, you're doing good, okay? Now, what is modest activity? Modest activity is any activity that is similar in intensity to brisk walking at a rate of 3 to 4 miles an hour. So if you've ever been on a treadmill and you know the little button that you hit up, well, anywhere between 3 and 4, however fast you're walking, that's the pace that they're talking about. They want you working at that intensity for 30 minutes a day. So it doesn't have to be walking. It could be riding a bike. It could be swimming. It could be whatever you want it to be, Zumba. It could be yoga. There's a lot of options out there. But that's what you're shooting for. So 30 minutes a day. And it's also been shown that it doesn't have to be a consecutive 30 minutes. So if you don't have 30 minutes of your day to just give up like that, if you do smaller intermittent bouts throughout the day, it has the same effect. So if I can only go on a 10-minute walk real quick while I have a break, go on that 10-minute walk instead of looking at TikToks. I know, it's hard. But, you know, go outside, get some fresh air, get some sunshine, and get moving. And people who already meet those standards of that 30 minutes a day, of that level of activity, will receive additional benefits if they partake in more vigorous exercise. So if you're there and you can do a little bit more, do more, because there's going to be compounding benefits there. This was a study performed among over 6,000 U.S. veterans, and there's they were classified into 5 categories according to fitness level. And this study was over the course of 6 years. So a pretty robust study, I think. If you see on the left, that's the relative risk of death. And then that bar that's the tallest, that is the least fit category. And then the one on the right is the most fit category. Okay? So the largest gains in terms of mortality were achieved between the lowest fitness group and the next lowest fitness group. So healthy adults who are the least fit have a mortality risk that's 4.5 times that of the most fit. Okay? So the more fit you are, the lower your mortality rate is. Okay? And that MET at the bottom, that's just metabolic equivalence, and that is the intensity at which you're able to work. Okay? So the more fit people have an MET of greater or equal to 13. That's just what that means. So, and surprisingly, an individual's fitness level was more important predictor of death than established risk factors such as smoking, high blood pressure, high cholesterol, and diabetes. So amongst this group, that's what it was. Fitness had the highest, it was the highest factor there. Okay. We're going to talk about risks of exercise. Obviously, exercise is considered to be extremely safe, and I would say that there's more risk in not exercising than exercising. Okay? So don't use that as an excuse. There is a transient risk of cardiac-related complications. So we're talking about heart attacks or a serious heart rhythm disorder. But the risk of the cardiac event is significantly lower among people who regularly exercise. So somebody who might have that type of event, it's probably going to be early on in their working out, just because it's something they're not used to. Once you get your body acclimatized to that activity, it's going to, your risk goes down, okay? Be aware of the warning signs here. So chest discomfort, unusual shortness of breath, dizziness, lightheadedness. Some of those could be attributed to dehydration. You never know. But if you experience any of those things, stop what you're doing. Seek immediate medical attention, okay? There is some discussion on target heart rates, heart rate monitors. I know the watches will tell you what your heart rate is. The research says that's really not something you need to focus on, because even the modest level of activity, like we talked about, the 3 to 4 miles an hour, is really where you're getting a lot of gains, even if you're just doing that. So you're not really having to focus on heart rates during exercise. Now, if you want to up your level, then that's something that I would look at, because we're talking about intensity. And you may, if you're recovering from maybe a heart attack or something, then you may want to take heart rates into account, because you don't want to get your heart rate too high. So that might be something to look at, is watching what your heart rate is while you're exercising. How to begin at becoming more active, okay? Firstly, consult your physician. That's what I'm going to say. That, usual disclaimer, talk to your primary care physician before starting any new physical activity. And then just try to integrate half an hour of moderate activity into your day. Think about your day. When would be the best time? Can you do a full 30 minutes? Do you have to break it up? Okay? And I like to think of this as an appointment with myself, okay? Just like I'm not going to cancel a meeting with a colleague because I respect their time, I need to respect the time that I set aside for myself to make myself a better person and do what I need to do to be well, okay? So think of it almost like that, like a meeting that you set, and yeah, things happen, and I missed my workout today, okay? And I have a friend who keeps me accountable, and she texts me, "Are you coming?" I'm like, I didn't make it, and I still haven't texted her back yet. But find a way to make it happen. Also, find something that you like to do. This should not be something that you don't enjoy or you dread, because you're not going to keep doing it. Now there's a lot of opportunities to be physically active. There's your Zumbas, there's yoga, there's CrossFit, there's walking clubs, there's running clubs, there's recreational sports, for adults now. So try different things, find a friend, go to something new, try it, you might love it. And then you're hooked, and then it's not even exercise. It's not even something you have to carve out time of your day. It's something you want to go do, okay? That's the goal here. Also, just work more activities into your day. So if you have stairs and your knees allow you to, take the stairs. Don't take the elevator. Walk around. If you have a break, go take a walk outside. So just find a way. I coach my son's soccer team. And my kids are on all the things, but if I'm at a practice or something where I don't have to be coaching, I'll take that opportunity to go walk or jog or whatever I can do. Try to be a good time manager, and anytime you can incorporate activity into your day, just kind of be creative in how to do that sometimes, okay? And then the most important thing is just getting started. Don't wait till next Monday. Don't wait till next month or next January, because then you're going to wish you had started, okay? I know a lot of us had New Year's resolutions. We probably already stopped doing them. What are we? It's the end of March. Okay, so let's try tomorrow to do something to be more active, okay? Because it's going to get easier, and you're going to get addicted to it. You go work out, you feel good after, okay? And you want more and more of that, okay? We have the time changing this weekend, right? So, yes, that gives you more time after work or whatever you have to do to be outside with daylight. We got some nice weather, gardening, walking, mowing the grass. I will say just walking and running in neighborhoods, please be careful. Drivers are not paying attention to what they're doing. The headphones in the ears makes me very nervous. If you're walking, you want to walk against the traffic, okay? If you're riding a bike, you're supposed to ride with the traffic. That makes sense, okay? So please be smart about that. Be aware of your surroundings. You'll feel better, and you'll have the motivation to continue. Okay, that's it. Yep.
With better awareness and appropriate preventative testing, cardiac outcomes in women will improve. Remember to care for yourself as well as you care for your loved ones, and don't ignore your symptoms. Together, we can decrease the effects of heart rate. Thank you again to our sponsors, Cardiovascular Institute of the South, Terrebonne General Health System, and the Foundation for Terrebonne General. And I just want to end with saying, bless your hearts for joining us tonight. Have a safe trip home. Thank you to our panel again. Yay, to our panel.